What if the most important moments of your birth weren't fully explained to you?
What if how the system really works could change your outcome?
Well, you've come to the right place. Welcome to Season 4 of the Birth Squad podcast.
We're Dr. Ijeoma Bello and Dr. Kimeshia Thomas. We are two OBGYNs with over 20 years of combined experience, and this season, we're bringing you all the way inside of the delivery room.
In the past, we've amplified the voices of birth warriors.
But now this season, we're adding something different. Our unfiltered perspective as physicians who have seen it all.
We're pulling back the curtain on labor and delivery, the real decisions, the real dynamics, and what actually impacts your outcome.
This is your blueprint.
Welcome to Season 4 of the Birth Squad. Well, welcome back to another episode of the Birth Squad podcast. This episode, we're going to be talking about an issue that is very near and dear to our hearts, and an issue that is imperative that we discuss, address, and, improve. And that's the issue of the fact that a lot of Black women enter pregnancy carrying two emotions at the same time, right? Excitement and fear. And it's not the fear of the labor itself, right? It's the fear of not being listened to. And honestly, when you look at the stories we continue to see in the media, that fear does not come out of nowhere. It's not unfounded. Recently, there was a story of a Black midwife and a mother who reportedly raised concerns about symptoms postpartum before her condition became critical. And what's heartbreaking is that so many women hear stories like that and immediately think that could have been me. That almost was me. Or that happened to someone I know, which is the worst one, right? So today we want to talk honestly and candidly about why Black maternal health disparities still exist in a developed country in the 21st century, right? Not to create fear, but to create awareness. We also want to provide education and hopefully along the way, better outcomes.
Yeah, and this conversation really does hit deep, one as a Black woman ourselves, right? And also as Black obstetricians. And I think one thing I think is really important to acknowledge is that for many Black women, pregnancy is not just joyful, right? It can also feel emotionally heavy. And because even if you personally have never had experiences that were complications, most Black women know someone who actually has, right? It could be a friend who had severe postpartum preeclampsia. It could be a cousin who almost had, or it can, just even be someone who felt dismissed in their labor, or someone's pain who wasn't taken seriously. And over time, those stories really kind of start shaping how we feel and how we show up in these healthcare spaces. And so when people ask, why are Black women so anxious about going into labor? The part of the answer really is because many of us feel like we have to be hyper aware or hyper prepared just to be safe.
And I think sometimes people imagine maternal morbidity and mortality as this sudden dramatic event. But unfortunately, most often it starts much quieter than that. It's a headache. It's shortness of breath. It's swelling. It's chest discomfort. It's severe fatigue that feels different. Symptoms that can initially seem small until they're not, right? One thing we really want women to know is that postpartum can actually be one of the most medically vulnerable times. And we've talked about postpartum and the importance of all the symptoms that you experience on our podcast before, but it just merits repeating, right? You've delivered the baby, so people assume the danger has passed. But that's not true, because you can be vulnerable and experience symptoms and conditions like a clot, like a blood clot in your leg or even in your lungs for that matter, a postpartum hypertension. So that could be preeclampsia, more specifically, cardiomyopathy, which is a condition where your heart has issues where it's not functioning correctly, infection. These can happen days or even weeks after delivery. And that is why listening to Black women matters so much.
Yeah. So let's walk through a scenario that honestly happens more than people actually realize, right? So imagine a woman, she's 1 week postpartum, she's exhausted, she feels which is expected, right? But she's also having some headaches. Maybe she attributes that to not sleeping very much or having blurry vision, swelling that's increasing instead of improving. And she tells herself, maybe I'm just tired. Or someone around her just kind of says, you just had a baby. postpartum is hard. You're probably just overwhelmed. But what if those symptoms are actually severe postpartum preeclampsia that's developing, right? And that's why education and understanding about the warning signs really matters, because a lot of women are taught about how to care for the baby, but they're not taught enough about how to recognize some of the dangerous signs that may manifest in themselves.
And we can't have this conversation without acknowledging bias. That's an important piece that we need to clearly articulate and give space for, right? Not necessarily intentional cruelty, not necessarily overt racism, but subtle differences in who gets believed immediately, who gets pain, whose pain is minimized, who gets labeled emotional or dramatic, whose concerns get escalated faster, right? Those small moments matter in medicine, because delay in obstetrics can become dangerous very quickly. Like, our specialty is 0 to 100 sometimes. And to be clear, this conversation is not about blaming individual providers, right? It's about recognizing that the healthcare system is made up of human beings, and human beings all carry conscious and unconscious bias, and recognizing that part is a part of improving care.
And honestly, one thing that I also see is that a lot of women sometimes second guess themselves, right, before speaking, especially Black women, because many have been conditioned to not appear difficult or dramatic or emotional, confrontational, don't want to be that angry Black woman, right? That's stereotype. So instead of saying something feels wrong, like, they minimize it, or they just wait longer to see if it's going to get better on its own, or they convince themselves that maybe they're overreacting. And sometimes that delay that we delay for ourselves because we're thinking about everyone else around us, that can become dangerous. So one thing I really want, the women today who are listening is hear this. You deserve to ask questions. You deserve to speak up. You deserve to be evaluated if something feels off, and you should.
Yeah. That's important, Ijeoma. It's a very important piece. And I think the good news is that awareness and support do make a difference, right? This is a movement. This isn't the first time we've talked about this issue. This has been ongoing for many years. But it's also important to understand that having support systems around women during pregnancy and postpartum is also what helps improve outcomes significantly. So what do we mean by support systems, right? That could be your partner. That could be a doula. We've talked about doulas many times on this channel. I was a former doula, so we're always going to be promoting doulas. It could be a trusted family member. I have people whose family are their doulas, right? A provider can also be your support team, a provider who you feel like listens to you well and understands you. Your community can be a source of support, because when someone else notices, like, my friend, my girl, my fam, she doesn't look well, or she's more swollen, or she's struggling to breathe, or she doesn't seem like herself. That matters, right? Alison Felix even told us a story about how her mom, she noticed swelling and she mentioned it to her friends and family around her, right? Sometimes your support system helps you identify complications earlier than you yourself.
Yes. And again, we're going to go back to the doulas because we love them. They're incredibly valuable, not because they actually replace medical care. In no way do they, but they actually have an even more important role, right? They're providing that continuous support in a healthcare system that oftentimes moves very fast, right? Very quickly. They help women be able to settle in, to ask the right questions, to process the information that's being thrown at them, and then also feel emotionally grounded so that you can also then make informed decisions and communicate your concerns, right? And especially for women who are already feeling like anxious about entering the healthcare system, if you had a history of a traumatic birth or any type of trauma from the healthcare system, just having someone whose sole purpose, their only role is to support you, that can be so powerful, not just emotionally, but actually just in a practical scenario too.
Mm-hmm. And before we finish, we want to review some like postpartum warning signs. If you haven't checked out one of our other episodes, we go into what's normal postpartum and what's not in more detail, but we want to highlight some things that we think that should never be ignored. So some of those items are severe headache, right? It's a hallmark sign of preeclampsia, especially if it doesn't go away with medicine. So if you have a headache and you've taken Tylenol, Motrin, and nothing has touched it, take your blood pressure, see what's going on, and reach out to your provider. Chest pain, right? As long as, sometimes we can get some chest pain when it's anxiety induced, but if you are feeling like that's not the cause of it, please reach out because we'll never be mad at you for mentioning chest pain. Another one that we've talked about is shortness of breath. You already delivered. You shouldn't be feeling so breathless anymore. You should be able to breathe better. So that's another warning sign, as well as heavy bleeding, specifically soaking a pad every 30 minutes, and that occurs for longer than an hour. That's another reason we'd want you to come in to be evaluated. Severe swelling, especially if you have swelling that's worse on one side versus the other, could be a sign of a blood clot, and we want you to come in immediately if you're worried about that. Vision changes also can be a sign of preeclampsia. Blurry vision, double vision. I had someone come see me one time saying that they couldn't see and their partner drove them in to see me. That's not normal. So please come in to be evaluated if you are noticing changes in your vision. And then fever, we can get infection in our breast, in our incision if we have a C-section, and even in our uterus. If you are having a fever and you don't think it's related to something like COVID or the common cold, please let us know so that we can help you be evaluated and treated appropriately. And then mental health, right? That's another reason that we should get care if we feel like something is wrong or our mood is altered to the point that we feel like we want to hurt ourselves or others. That's another reason we would ask, please, please, please come in to be evaluated. And, if you are ever uncertain, it's okay to call in, to be seen earlier, to seek care, because you're not bothering people. It's our job, okay? So never feel like you're a burden and you are not overreacting.
Not at all. Exactly. Just say something, right? And Black maternal mortality is not just a statistic, right? These are real women. These are real families. These are real stories. And while the problem is very complex, right, on an institutional, systemic level, one thing is very simple. Women deserve to be heard the first time.
Absolutely. And I think it's important that you remember that when women are listened to earlier, supported better, and taken seriously, we improve outcomes. So this is exactly why we're very excited to announce that our organization is developing workshops specifically designed for doulas who support Black women through pregnancy and postpartum care. This isn't just about theory, okay? It's about practical guidance on navigating hospital systems, communicating effectively with medical teams, and advocating in high-pressure situations without escalating conflict. So we are providing real strategies, real communication tools, and real insight from inside the system, because this work is bigger than education alone. It is about protecting lives, preserving dignity, and helping ensure patients receive the care that they deserve. So if you know a doula, share this conversation with them. The right information in the right hands can absolutely change out.
Really want to leave you with the fact that maternal health disparity facing Black women is real. And the most important thing about that is it is preventable. But prevention requires honesty. It requires accountability, awareness, advocacy, and action at every level of the system. So because when patients are heard earlier, they're supported better and they're taken seriously the first time, and then outcomes improve. And so that is the standard that every patient deserves.
Until next time, we'll see you later.